Minoxidil. It's a super drug for hair loss, but it comes with its own share of hassles. It needs to be used long term, which is the biggest problem. So, should you use it? Should you not? If you want to, how should you use it? Let's get into it. Now, how does minoxidil work? What it does is it increases the microcirculation around the roots of your hair follicles, providing it better nutrition. It helps with increasing growth factors and enzymes that promote hair growth in that microenvironment around your follicles. So it really helps with growth. It also, to some extent, reduces the hormonal stimulation that causes a miniaturization of your follicles. So essentially, to simplify it, what it does is it holds on to your existing follicles big time, and it helps with the generation of new follicles to some extent as well. Now, first of all, who should use minoxidil? Minoxidil is made for people with chronic long-term causes of hair loss. Like, for example, males with male pattern balding or male pattern hair loss. This happens because of male hormones. So as long as you are male, you're going to have that thinning persisting. So the treatment for your male pattern hair loss is never going to be temporary. So minoxidil is a great choice for you. Again, in females with androgenetic alopecia, which usually happens because of hormonal cause, like people with PCOS or people with any hormonal cause of thinning, like even post-menopause. Also, people with chronic telogen effluvial. So there isn't a hormonal cause per se, there isn't a pattern hair loss, but you are having this chronic long-term thinning, a long-term hair loss. That's where minoxidil is the right choice for you. Now, who should not use minoxidil? If you have a really reversible cause of your hair loss, like for example, it's just a post-COVID hair fall, post-dengue or malaria, post some surgery, post your pregnancy. These are temporary reversible causes of hair loss. Even if you lose a lot of hair during this period, it's all going to come back because this is just your hair going through certain cycles because of the stress that your body has gone through. So I would suggest at a time like this, don't commit to something as long-term as minoxidil. Next, if you are pregnant or you are lactating at this point, minoxidil is not safe during pregnancy and breastfeeding, so don't take it at this time. Children under 18, again, minoxidil is not approved, so I would recommend don't start on minoxidil if you're under 18 years of age. Lastly, if you feel you can't sustain this long term and you're not going to be able to do this for the rest of your life, I would suggest don't get started on minoxidil. You need to commit to it and it needs to be a lifestyle choice. Now, how do you use minoxidil? Minoxidil needs to ideally be used twice a day. But frankly, in my experience, nobody manages to apply it twice a day. You need a lot of dedication and commitment for that. So at least try to apply it once a day. If you forget 1 or 2 days, kabhi to, it's completely fine. But try to stick to using it every day, at least 5-6 days in a week makes sense. Now, what you need to do is take 1 ml in a dropper and apply it on the crown area of your scalp with a few drops in all the areas. That is right from your frontal hairline to your temples, to the vertex, which is this part right here. Spread it in, massage it in with your fingers. So you also provide the benefits of a scalp massage with it. Don't let the minoxidil drip onto your face. Tilt your head backwards a little bit and it just dries up in 2-3 minutes. That's it. You need not necessarily wash it off the next day. Stick to your regular hair wash schedule and you're good. What if you do PRP? What if you do a hair transplant? Do you still need to use minoxidil? Yes. Now, firstly, what is PRP? I do have a video talking about what PRP or GFC is. The link is right here. You can click on it to watch that. These are procedural therapies to further maintain your hair. Now, the problem is PRP has a completely different mechanism of action. It works by increasing growth factors to your scalp. Minoxidil has its own mechanism of action, and both of these are complementary to each other but not a replacement for each other. So ideally, even post PRP, minoxidil is still your friend. Post a hair transplant too, you need to use minoxidil to support those transplanted follicles. You might have heard of a lot of hair transplants failing. Very often it's because people view it as, a one-time solution, ki hair transplant kar diya and now you're good for life. But honestly, that's not how it works. You need to still keep supporting those transplanted follicles as well with minoxidil. So yes, if you have hair thinning, no matter what, minoxidil is part of your life. The next question about minoxidil, the biggest question is, are the results temporary? Yes, it is temporary. It's temporary only till the point that you keep using minoxidil. But you're not supposed to stop using minoxidil. So, yes, once you stop using minoxidil, if you use it for 2 years and then you suddenly stop it, yes, you will see a lot of hair fall happening. What is that hair that's falling? It's new hair that had come because of minoxidil. Those hair require minoxidil to stay on your head, so you're supposed to keep using it. Or hair that would have shed off eventually in these 2 years, but they had stayed because you were using minoxidil, also will shed off once you stop using minoxidil. But if you do continue using minoxidil, all of those hair will have that support and they will stay. The deal is, it's the best medical option that we have for stalling hair fall in today's day and age. Is it lifelong? Yes. But is it worth it? 100%, because it's really going to slow down that thinning like nothing else. It's not a big deal. It's just like applying hair oil every day, which a lot of people do anyway. You can apply minoxidil every day on your scalp. This video, let me tell you, first of all, is not sponsored by any pharma company or anything like that. This is just a medical fact that I'm letting you know. Next comes oral minoxidil. Now, oral minoxidil is this new buzzword happening. It has better results, works systemically, and it has better compliance that, you just pop a pill, you don't have to keep applying something every day. But honestly, it's better to use it again as an add-on rather than a replacement for topical minoxidil. Oral minoxidil was discovered in the 1960s by a company called Pfizer now, or back then it was called Upjohn. It was discovered as a medication to lower your blood pressure. It was in much higher doses than we use today. It was used as 10 to 40 mg per day. While they launched it and when they were studying it on people, they realized that as a side effect, a lot of them started getting a lot of hair growth, and that was great. Immediately the company studied this and they realized this is a notable side effect. They marketed it as a topical formulation, they patented it, and they made millions. The patent is now lifted and almost every company now has topical minoxidil available, but it genuinely does work wonders. And this is how so serendipitously minoxidil as a drug for hair growth was discovered. Now, while it's always been used typically in a topical form, oral minoxidil is making a comeback for hair growth, not so much for lowering your blood pressure. We use it in much lower doses, just about 1.25 to 2.5 mg per day. When it lowers blood pressure, it's 10 to 40 mg per day. So it's quite safe. The possible side effects that you may want to watch out for is an increase in hair growth elsewhere on your body. Like, this could particularly be an issue in females. However, this is a pretty rare side effect. I haven't seen it happening to too many of my female patients. There could be a slight drop in blood pressure, again very, very rare at these doses. I haven't seen this in any of my patients, but there could be a little bit of dizziness, a little bit of swelling in your feet. These are side effects that some people have found, but again very low at these doses. If you have any more questions about minoxidil or anything about hair growth particularly, you can ask me in the comments. Do follow our page for anything skin and hair.